Recognizing the early signs of autism in children can make a world of difference in how they are supported and how early interventions can be implemented. Autism spectrum disorder is a developmental disorder that affects how a child perceives and interacts with the world around them. It is important to remember that every child with autism is different, and the signs can vary widely. However, there are several common indicators that parents, caregivers, and healthcare professionals can look out for. In this video, we'll dive into the early signs of autism, helping you understand what to look for and how to seek help if necessary. Delayed or absent speech and language development. One of the most common early signs of autism is a delay in speech and language development. Children with autism may not speak at all or may have a limited vocabulary. Some children may develop language skills at a typical pace, but have difficulty using language to communicate socially. A child with autism might not say their first words by age 1 or may not engage in meaningful conversation by age 2. Even if a child begins speaking, they may have difficulty holding a conversation or understanding the back and forth nature of communication. They might also avoid eye contact while speaking or may not respond when their name is called. In some cases, children with autism might develop language in unusual ways. They may use echolalia, which is the repetition of words or phrases that they hear, or they may use language in a repetitive and non-functional manner. Limited or absent social interaction. Social interaction is another key area where children with autism may show early signs of difficulty. A child with autism might show limited interest in interacting with others, even those they are close to, such as family members or caregivers. Some children with autism may not engage in joint attention, which is the ability to share focus on an object or event with another person. A typically developing child might point to a toy or a picture to show it to their parent, but a child with autism may not do this. They might not smile in response to social cues, such as a parent smiling at them, or they may not engage in social games like peekaboo. Children with autism might not show typical emotional reactions in social situations. They may not express emotions like joy, excitement, or empathy in ways that others would expect. They may not seem to notice when someone else is upset, or they might not seek comfort from others when they are distressed. Lack of eye contact. One of the most noticeable signs of autism in young children is the lack of eye contact. While many children naturally make eye contact when communicating or interacting with others, children with autism may avoid eye contact altogether. This can sometimes make it difficult for others to connect with the child or to interpret their intentions. It's important to note that a lack of eye contact doesn't necessarily mean a child is uninterested or unloving. Children with autism may find direct eye contact overwhelming or distracting, and they may have difficulty processing social cues through facial expressions. They might prefer to look away while engaging with others, or might only make brief, fleeting eye contact. Repetitive behaviors and routines. Children with autism often engage in repetitive behaviors and rituals. This can include repetitive body movements, such as hand flapping, rocking, or spinning, or it may involve repetitive use of objects, such as lining up toys or repeatedly stacking blocks. These behaviors can provide a sense of comfort and predictability for the child. Children with autism may also become very attached to specific routines or rituals. A slight change in their routine, such as a different mealtime or a new teacher, can lead to significant distress. These children may become upset if their routines are disrupted or if they are expected to try something new or different. That these repetitive behaviors and attachment to routines are not necessarily negative. They can be part of how a child with autism processes and copes with their environment. If these behaviors are extreme or significantly impact the child's ability to function in daily life, they might be indicative of autism. Unusual reactions to sensory stimuli. Sensory sensitivities are common in children with autism. Many children with autism are either hypersensitive, overresponsive, or hyposensitive, underresponsive, to sensory input, such as lights, sounds, tastes, and smells. These sensory sensitivities can lead to unusual reactions to everyday sensory experiences. A child with autism might cover their ears and become distressed in response to loud noises, or may avoid certain textures, such as the feel of clothing tags or particular fabrics. On the other hand, some children might seek out sensory input, such as by spinning objects or excessively touching things. Understanding a child's sensory sensitivities is important because it can help caregivers and professionals identify triggers for stress and anxiety and develop strategies to help manage these reactions. Limited interest in play or play with objects in unconventional ways. A typical developmental milestone for young children is pretend play, where they engage in imaginative activities, like pretending a doll is having tea or acting out scenarios with toys. Children with autism may have limited interest in pretend play or might use toys in a highly repetitive and non-imaginative way. Rather than pretending that a toy car is driving across a road, a child with autism might line up toy cars in a specific order or may spin the wheels repetitively. Some children may be drawn to specific parts of an object, such as the wheels of a toy car, and focus on those elements rather than using the toy in a typical way. It's also worth noting that children with autism may prefer playing alone or may not show interest in playing with other children. They might not engage in social play or share toys as other children do, often leading to social isolation or difficulty in group settings. Difficulty with transitions or changes in environment. Children with autism often struggle with transitions, particularly when it comes to changing activities, moving to a new location, or being introduced to new people. This difficulty with change can manifest as meltdowns, crying, or resistance to moving forward with an activity. A child might get very upset when it's time to leave the playground, or they may have trouble adjusting to a new classroom environment. A change in routine, such as the introduction of a new teacher or a change in the family structure, can cause significant stress for children with autism. These challenges with transitions can be supported by preparing the child in advance. Visual schedules, social stories, and advance warnings about upcoming changes can help reduce anxiety and make transitions smoother. Unusual movements or body postures. In addition to repetitive behaviors, some children with autism may exhibit unusual movements or body postures. These might include frequent hand flapping, rocking back and forth, or toe walking. These movements are often self-stimulatory behaviors that help the child manage sensory input or emotional distress. While many children may engage in occasional repetitive movements, these behaviors can be more frequent or intense in children with autism. If these behaviors interfere with daily functioning, it is worth discussing them with a pediatrician or developmental specialist. It's important to remember that the signs of autism can vary from child to child, and no two children will have the exact same experience. Some children might show several of these signs, while others may show only a few. If you suspect that your child may have autism, early intervention is key. The earlier a child is diagnosed, the sooner they can receive the support and services they need to thrive. If you notice any of these signs, it's important to speak with a healthcare professional who can evaluate your child and provide guidance. They might recommend seeing a developmental pediatrician, psychologist, or other specialists who can provide a thorough assessment and help you navigate the next steps. Early recognition of autism can lead to better outcomes for children, as early intervention can support their development, help them build communication skills, and reduce behavioral challenges. If you found this video helpful, please like, comment, and subscribe to Autism Insight for more content on understanding and supporting children with autism. Thank you for watching.